invitation, and I'm very happy to be today with you because there's a huge differences between your language and our language. We are scientists in a natural science, let's say. We are doing embryology, we are doing biology and application of stem cells. You are doing completely different thing, and therefore sometimes we are speaking the same language, but we are using the different terminology. My aim is to give you one historical introduction about the development of embryology and the development of stem cell biology and application, medical application of stem cells. And as you can see here on this slide, it is, I would say, the huge history behind desire to replace certain tissue, cells, organs. Like here, it's approximately 1,800 years ago when this was painted and presented the replacement of leg. So as you can see, the patient has one very dark leg, and the nurses, I suppose, are trying to replace, and physicians also trying to replace the ill leg. So this is the idea background. The idea behind is when you have the patients with cells or tissue or organs which lose their functionality or don't produce certain factors like insulin, for instance, they could be replaced by stem cells. And stem cell therapy is nothing new. That's already since 1960 in the last century applied for curing of different hematopoietic diseases, and I will show you some slides about this a bit later. But to develop medicine or to develop drug, it's a need plenty of things, especially to develop a stem cell therapy. So here's what we need to move to stem cells from lab to patient bedside. So you see, we need genetic identity, we need to produce clinical safe stem cells, purity of stem cells. That means you have to match certain SOPs, standard operation procedures, and of course governmental regulations. You have to deliver these stem cells adequately, and of course the most important is functionality. So if you try to help people, then these stem cells should help and not be detrimental, but this happens also plenty of times. So, but for all this, you see, we need time. Time is the most important factor, but you will see later also connected to this time, the politics, the ethics plays a very important role in the speediness of stem cell therapy and also in application of science into real life. So, to your background, only what exactly stem cells are. You have different definition of stem cells. We define the stem cells as a primitive cells, which don't have any decision whether they will be liver cells or whether they will be hematopoietic cells or whether they will be pancreatic cells, cardiac cells, etc. So that's a primitive cells, and you have different types of stem cells. You have pluripotent stem cells, you have adult stem cells, of course you have also cancer stem cells. So what is the definition actually for all types of stem cells? The definition is the functionality of stem cells by itself. That means you have, the first one is of course the self-renewal. What means this? That means when you have one stem cell, these stem cells can divide in two identical copies, daughter cells, which are also stem cells. But they are able also to differentiate. That means they are able to specialize or mature, and then from stem cells, for instance, you have neuronal cells. That's a differentiation. And therefore you have different classification of stem cells. The one is, for instance, pluripotence. That means that these stem cells can give you all cells in the embryo, ectoderm, mesoderm, and endoderm. From pluripotent stem cells, theoretically and practically more and more, you can have in the lab 220 different cell types of human body. That's very important. Then you have multipotent stem cells. Multipotent are limited in their differentiation. They can give you a couple of cells, different cells. Then you have unipotent. They can give only one type of cell. And then you have nullipotent. They're not able to differentiate at all. And the most important, you have totipotent cells. And totipotent cells is a fertilized egg, for instance, because fertilized eggs can give you placenta and 1 embryo. So that means can give you a entire human body. So this is where starts also I would say, the discussion between the people who are working in the lab and discussion who are dealing with politics, ethics, religious discussion also when the life starts, etc. Because what scientists are doing is only trying to mimic this early development. What means this? That means if you have one fertilized egg, and from this fertilized egg you obtain 1 embryo, so you might have a very important tool to isolate embryonic stem cells, human embryonic stem cells, and then you can have in the lab all sources of different cell types of human body to replace them for the patients. And this is the one aim why people are using surplus human embryos for scientific purposes or for derivation of human embryonic stem cells. As I told you, we are trying in the lab to mimic what Mother Nature created, and this is we are trying to do in some, let's say, faster way, because we would like to learn plenty of things about diseases and how to fight diseases. And therefore we have also these stem cells, adult stem cells, which are found in a tissue already formatted body. So that means all of us, we have adult stem cells, we have cardiac stem cells, we have neuronal stem cell. That's a so-called endogenous stem cells. So this means from the body. And these stem cells are responsible to make cells or to make a tissue in which they are found. For instance, skin stem cells, skeletal muscle stem cells. It's logical. And these stem cells are very important to us to understand the mechanism, biology, development, differentiation, normal, especially abnormal, because adult stem cell may become cancer stem cell. So that's only one step between adult stem cell and cancer stem cell, and where there is a similar behavior of these stem cells and also similar biological, like say, marks between adult stem cells and sometimes cancer stem cells, because here are the list of only some diseases which are actually listed on this slide, and the origin of these human diseases are actually from the cancer stem cells, like leukemia is the most prominent, I will say, example here, melanoma, neuroblastoma, etc. So therefore, because you have this classification, you have also diseases which are connected to stem cells, and then you have diseases like hematopoietic diseases. These are so-called bone marrow failure syndromes. Fanconi, aplastic anemia, Diamond-Blackfan anemia are the most prominent example. Then you have diseases which are, as I mentioned at the beginning, on my first slide, when you have disease when stem cell doesn't work anymore, or let's say cell of the human body, and there is no stem cell pool anymore. The most prominent for this is, for instance, type 1 diabetes. Type 1 diabetes, you have juvenile type 1 diabetes, and this is when a patient is destroying his own beta cells, and there is no any possibility to replace these beta cells, but there is a hope that you can replace them using the stem cells. And of course, as I mentioned, malignancy, teratoma, leukemia, Wilms tumor, etc. So this is connected with the stem cells. What is the stem cells? And the couple of diseases where stem cells are already applied, or the scientists and clinicians already develop medical application of stem cells. And the first stem cell transplantation was done in 1967, believe it or not, and was published in Philosophical Transaction. And of course, in England, that was the first human blood transfusion. So, as written here, sort of, because this gentleman, probably who suffered from syphilis, was treated by lamb's blood, and in order to cure syphilis, and as we have this joke, the treatment was successful, patient died some time later. So, but this is nevertheless the first scientific publication about stem cell transplantation. This is a blood, it was from lamb. More serious work was done in, I would say, 200 years ago, when Valentin Hacker and Arthur Pappenheim presented some diagrams on blood development. And the huge development of hematopoietic stem cells was actually caused by human stupidity after these two occasions. The one was in Bari Harburg in Italy, where German ARAD was one ship, is a US John Harvey, was hit and then exploded many tons of mustard gas filled ammunition. So that means this was the reason why the population there and also soldiers suffered from extensive leukopenia, and this was published in two very important papers, one in 1919, one in 1946. And the second was little boy and fat man, uranium and plutonium, and also as a consequences, extensive leukopenia. So scientists started to develop the strategy to treat these diseases, and first transplantation therapy using stem cells, bone marrow, was done in the 50s and 60s, and these two guys for this obtained Nobel Prize. This is Joseph Murray and Donnell Thomas. So this is the beginning of the stem cell therapy and beginning of development of stem cells for regenerative medicine. But these are hematopoietic stem cells. And the advantage of hematopoietic stem cells, we have here two different things. The one is autologous and one is allogenic transplantation. Auto, it means you get your own cells. Allogenic, you get cells from someone else. So this means somebody is donating stem cells for you. And this is, for instance, one example, bone marrow infusion, regularly used, and that's routinely everywhere, all around the world. Takes guts to treat different patients, especially patients with, for instance, leukemia and different blood diseases. But the way was very, very long until the scientists achieved this. The plenty of scientific work is behind. This is the one of biggest scientific achievement when the scientists were able to purify and completely characterize hematopoietic stem cells, applying just simple techniques like FACS analysis. People who are familiar with FACS analysis, this is nothing else than cell sorting. Then you have to divide batch of good cells, let's say stem cells in this case, and bad cells, cells which doesn't help you. And this was the one of the first development, and plenty of you are more and more faced with umbilical cord blood stem cells, which are, I will say, overestimated for the medical reasons. And the reason for this is that with isolated hematopoietic stem cells from umbilical cord blood, you can treat only a large child, let's say. But you're taking the stem cells from a baby, let's say average 3.1, 3.2 kilos, and you promise the patient that one day if you freeze these cells, you can use them for several diseases. That's not the truth. The chance that you will use umbilical cord blood stem cells is a 0.0004%. That's an issue about the cord blood. Of course, if you have in the family certain history, Hodgkin, non-Hodgkin, etc., then you should freeze, cryoprotect umbilical cord blood. But you can't tell the people, if you have a child with type 1 diabetes, you have to have the second one and then the freeze the umbilical cord blood, and this will help the first child. That's not true, really, not at the moment. So this is umbilical cord blood, but of course there are other stem cell types, for instance, neuronal stem cells. We have the plenty of discussion whether neuronal system possess any stem cells because of the slow regeneration. And now, meanwhile, we know that there is some neurogenesis also in a human brain and also in the spinal cord. This one is very interesting because, as I already mentioned, type 1 diabetes. This is a trial done in Canada where the scientists and clinicians took from a donor, from DOD, donor patients, beta island, and transplanted the people who suffer from diabetes with very nice results. And of course, then you have plenty of beautiful news from the lab, generation of functional mammary gland from a single stem cell. So that means from one stem cell you derive functional mammary gland, and you have also the research which go in direction cancer stem cells. As I mentioned, this is when good cells go bad. And this happens with cancer stem cells because the scientists recognize that not all cells in tumor are the same. So within the tumor cells you have specific cells, and these are stem cells, tumor stem cells, which are divided more aggressively than normal cells, and this is the problem how to target these cancer or tumor stem cells. So here on this slide are one for instance example in a human acute myeloid leukemia and how it is going from the cancer stem cells, and that these are specific stem cells, and therefore you have a specific diseases also connected to stem cells. So, as I mentioned, you have adult stem cells which make specific tissue, but adult stem cells are limited in their differentiation potential. So you can have only a couple of different cells, especially if you want to do targeted differentiation under lab conditions. The more powerful are pluripotent stem cells, because pluripotent stem cells make adult stem cells. All of us are from pluripotent stem cells. And this is the advantage of pluripotent stem cells, because they give you 220 different cell types of human body. And we are coming back to this early development. On your left-hand side, you can see the human egg. Fertilized human egg gives you a zygote. That's a fertilized human egg. And this zygote develops after a couple of days in blastocyst. Blastocyst is the embryo who gives you for the first time two different cell types. The one is a trophectoderm, that's the outer membrane, and one is the inner cell mass. And the inner cell mass gives you baby. Trophectoderm gives you placenta. But inner cell mass gives you also embryonic stem cells. Embryonic stem cells are pluripotent stem cells. And this is a colony of human embryonic stem cell after isolation of inner cell mass from surplus embryos. And these surplus embryos you have worldwide in IVF clinics for in vitro fertilization or for treatment of sterility. And this is again the blastocyst, and the blastocyst is a human embryo which has 150 to 200 cells in total. Gives you again different cell types. The most important is the inner cell mass, and these blastocysts are used for different things. The one thing, if you have a childless couple, to transfer them back to mother. If you have, for instance, 5 blastocysts, you are, according to regulation, and also a better statistical analysis show us that 1 blastocyst is more than enough to do for embryo transfer, so this means for pregnancy rate. You have, for instance, 5 blastocysts. The question is what you are doing with 4 blastocysts. You have the possibility to freeze them for one another trial. You have the possibility to use them for science, and then you have the possibility to discard them. That means to put them in a rubbish bin. And the patient decides which way you are allowed to go. So you need consent from the patient. And when I worked in the United Kingdom, we had many of surplus embryos. For instance, in the United States, you have 400,000 frozen embryos, surplus embryos. Nobody wants them, so they will be discarded. So we asked the patients, what should we do with this? And some of them decided to freeze them. Some of them told us, no, you have to discard them. And we done this. But some of them donated them for research. And we used them for research, and we used them also to derive human embryonic stem cells. And human embryonic stem cells are the pluripotent, the most powerful stem cells at the moment, which can be isolated and grow in the lab. But this story started to develop in the 70s. You remember the older one for sure, and I remember from all the scientific papers, the born of first baby after IVF treatment was in the United Kingdom in 1978. And these people actually developed a new strategy for reproductive medicine, for artificial techniques, when the childless couples need help from clinicians to obtain to obtain a baby. And again, this was the first one, and since then, to my belief, there's more than 4 million babies born after IVF treatment. This baby is now a mother, and I think she got now a daughter, and for her and for her parents probably changed completely life after introducing of this technique. So this was done by Bob Edwards. He obtained a Nobel Prize 2 years ago, and believe it or not, Bob Edwards was somebody who was studying agriculture and moved to animal reproduction. From animal reproduction, with Opsengane, he developed this technique, and this technique helps us now worldwide to help the people, especially childless people, to obtain kids. And how it's working on it is, I will show you the one movie what is in vitro fertilization or fertilization of human eggs under lab conditions. On this movie you see the human sperm. And the people who are doing in vitro fertilization, or ICSI, that's intracytoplasmatic sperm injection, has to immobilize the sperm. And you see this is a small needle. It's a 7 micrometer in the diameter, because human eggs has approximately 120 to 150 micrometers in diameter. And then the embryologists introduce, you see on your right hand side, introduce sperm directly into human egg. This is especially now very popular technique, because more and more male patient has low number of sperm, or they have high number of non-motile sperm. So that means they don't swim. Yeah? So embryology has to help them to go directly into human egg, and this is the technique how to fertilize human egg in the lab. And of course, after a couple of days, you obtain human blastocyst. This is after 5 days, and human blastocyst is approximately 150 micrometers in the diameter, and this is what we are giving our patients back. So this is the blastocyst, human blastocyst. But all this development was surrounded by plenty of good, but also of bad news, and also huge pressure from the politics, huge pressure from church. I spoke to Bob Edwards, and he told me they put some Molotov cocktails in his house, cars, etc., because people were not agreed that he is, let's say, playing a god. Who is he to create a human life, and at a certain point maybe also to destroy human life? And we are all looking here from Europe at the United States as an engine of the science, especially our science, what we are doing. And if you go in the 80s, there was created one advisory board who was responsible for ethics, but also to advise people, scientists, politicians also, which research could be allowed or not. And in the 80s, embryo and fertilization research was banned in United States, not in United Kingdom. After Carter, you remember, we got Ronald Reagan, and the same was no. But nevertheless, scientists use different, I would say, tricks how to learn about the development, and they used animal material, and this is the first derivation of embryonic stem cells from mouse blastocysts, already done 1981. Okay, you will see later when was the first human embryonic stem cell line was derived. You will see the huge time gap between these two achievements. And these two persons independently developed a technique how to obtain embryonic stem cells from animals. Obtained the one, Martin Evans obtained for this Nobel Prize. So we have these two guys, they told no. That's another one, George Bush Senior, he told also no. In the 19th, we had Bill Clinton, who removed all these prohibition and bans, and he told yes. That was for the first time, I would say, after 20 years in the United States, that this was allowed, and not only allowed, but also supported, financially supported by government, all this research. And this is important because NIH also told yes, we will also support financially this research. This is while Bill Clinton was in power. You remember 2001, George Bush Jr. came on power and he told no. Then he told, okay, some I guess, because he told, no, we will use the stem cells which we derived already, but we will not allow derivation of new stem cell lines. So there was something like a double morality, because you're allowing to use human embryonic stem cells which are isolated, but you don't allow to derive new lines of stem cells. Another part of the world, in United Kingdom, especially in Scotland, the scientists done something completely different, and something which is amazing, because they created the first viable offspring derived from adult mammalian cell, and this is a somatic cell nuclear transfer or cloning. What they have done, they use adult cells as a genetic material, genetic background to create one animal. It's working very easily. These are some cloned calf, for instance. You see no any differences between normally, let's say, developed and cloned calves. It's working like you have to replace genetic material from one egg, and to replace this genetic material with genetic material from one other animal, completely different. The amazing in this process is not that you create cloned animals. I would say what for us was at this time really, I must admit, nice to see that you are able to reprogram adult cells back in the embryonic cells. So that means you are able to turn biological clock completely back and then to obtain really, really completely reprogrammed embryonic cells. And this opened the field for epigenetics and for reprogramming, because this opened the field that something like this might be useful for all of us without usage of cloning. And in parallel to this work, the scientists finally obtained the green light to derive human embryonic stem cells. And you see it's written 1998, and the first mouse embryonic stem cell lines was 17 years before the scientists were able to isolate human embryonic stem cells. So you mean, again, this time gap was very, very huge, not because we had to learn how to derive, we knew how to, but was, for instance, a long way to discuss, and I would say also to be supported by all people how to use surplus and donated embryos to derive human embryonic stem cells, and this happened for the first time in the United States, again in 1998. We worked together independently with South Korean scientists how to clone human embryos, because not to produce a human baby, cloned human baby, we wanted to introduce adult somatic cell into human egg and to derive human clone blastocysts, and from these blastocysts to obtain embryonic stem cells for only one reason. We wanted to study inherited human diseases. So that means if you take a cell from somebody who has, for instance, Lou Gehrig disease or other inherited human disease, create cloned embryo with this inherited disease, and then isolate pluripotent stem cells, you have a powerful tool in the lab to study these diseases. So that means everything in the lab control situation. Luckily, this was also, I will say, motivation to other people, and this motivation was used by scientists from Japan, where they presented in 2006, I will say, a revolutionary idea or result. They derived mouse embryonic stem cells which are not derived from embryos. So they don't use embryos. Meanwhile, nobody uses embryos for derivation of pluripotent stem cells. They used one trick from 24 different genes which play a very important role in pluripotency. They identify 4 most important, and these 4 most important were introduced in adult somatic cell in the fibroblast. Fibroblast is a skin cell, And they were able to convince these fibroblasts or skin cells to become embryonic stem cell. So they were able to turn the clock back. You have a skin cell, and then from skin cells you get the pluripotent stem cells, which can give you again 220 different cell types. So I think that's amazing, and this was granted meanwhile by Lasker Prize, and meanwhile we have human, and we call them induced pluripotency stem cell because we are inducing the pluripotency. We don't use embryos to derive pluripotent stem cells, we use genetical manipulation and we use adult cells. And meanwhile, we have what was the aim of therapeutic cloning, now using this method, disease-specific pluripotent stem cells. And here only some list that you have, for instance, now from Duchenne muscular dystrophy, from Becker muscular dystrophy, from Down syndrome, Parkinson's disease, juvenile diabetes, Huntington disease, all these diseases in a plastic tissue. So you don't use people anymore to investigate these diseases, you use their cells, their skin, to reprogram into pluripotent stem cells and to study pathogenesis of these diseases. And this was the aim of the therapeutic cloning, but this is a very unsuccessful method. We don't need this. Now we have this one, which called induction of pluripotency. And there's a plenty of study. You will see this was published in 2008, but meanwhile we know that embryonic stem cells and iPS cells are not the same. They're very, very similar, but unfortunately they're not the same because of the reprogramming. And reprogramming makes still us believe that we will get there and have iPS cells which are same as embryonic stem cells, but during this manipulation certain problems occur. The first one is how to deliver these genes. We are using retrovirus and lentivirus. You can't use these cells for therapeutic purposes because you will introduce them automatically viruses. And also there's a plenty of epigenetic problem when some genes are off and when genes are expressed or active, and some of them result in something in confused gene expression because of this reprogramming. I can imagine that when you're trying to turn clock back from human cell into pluripotent cells, that plenty of epimutation happens, and therefore we have not the same behavior of iPS cells and embryonic stem cells. Again, very similar morphologically. I will never be able to distinguish these two different cell types because they look same. They have same differentiation potential, but they are unfortunately not exactly the same. Meanwhile, we have another techniques also where we can, for instance, also avoid derivation of iPS cells, induced pluripotency stem cells. So that means if you have a skin cell, then you have to go back to pluripotent, and then from this pluripotent eventually get back to pancreatic cells or to neuronal cells. Meanwhile, we have another method where we can use a skin cell to obtain neuronal cells. That gives us plenty of opportunity now to analyze which factors are factors which drive differentiation of stem cells, and if you identify these factors, here these three factors, if you introduce this in the skin cells, you will obtain functional neuronal cells. And that gives us also plenty of opportunity if you have, again, some inherited human diseases, that you differentiate these cells directly in the plastic dish, avoiding the step going back to pluripotency and then again down to neuronal cells. Science, and you have maverick scientists. And one nice example was in the United States 2 years ago. The snake oil was again like something to treat everything. And you remember these old Western movies when the people traveling from city to city selling all these nice helpful liquids and helping against all diseases. And the same happened now with stem cell. In some countries and some places, unfortunately, even in Germany, even in Austria, you will have for 20,000 euros stem cell treatment which has no any logic to be used for this kind of treatment. Why? For instance, they offer bone marrow stem cells, hematopoietic stem cells, for treatment of neurodegenerative diseases. And if we know that hematopoietic stem cells give you blood cells, there is no any logical explanation why to use. Of course, layperson doesn't know this, and people are desperate to get some medicine, and therefore they are going there and taking these stem cells, let's say therapy, again from 20,000 euros, but everybody knows this is for nothing. And therefore, Association for Stem Cell Research has own body, and this is the homepage where you can find very nice all answer to your question about stem cell treatments, patient handbook, and the most important, how science becomes medicine, because you can't take one cell and treat patients without serious scientific lab research. And you will see now in a couple of slides how it's actually working. These are human embryonic stem cells beating cardiomyocytes in a plastic dish. And if you add different drugs, the frequency of beating is different. So that means you use also stem cells to develop new drugs. But you are using also these beating cardiomyocytes using animal disease models to introduce stem cells and to track these stem cells. On your right-hand side, where the red cycle is, that means that's the place where the stem cells are engrafted. But using animal disease model, not using human patients to see what happens to these cells. Or this is the work of my previous postdoc while I was working in Spain. And you see this is a spinal cord injury animal disease model. On your left-hand side, this is a rat with spinal cord injury. I hope you can see on your right-hand side. This is a treated rat, and the locomotor ability of these two are, and differences in locomotor ability is huge. There are animals who obtain stem cells, and this is an adult stem cell, endogenous neuronal stem cells, were able to use all for limbs and also tail in 80% of all these cases. And why is this? This is because when you sacrifice these animals, you see here on immunohistochemical analysis, these green cells are stem cells which engrafted in injured spinal cord. So that means when we introduce stem cells, 2 millimeter rostral in 2 millimeter caudal from the injury place, they were able to migrate 2 millimeters. And we found them then in a place where the spinal injury was. So that's an advantage of, I would say, serious scientific work. And the second is that we learned that there are also some endogenous stem cells in our body, which maybe we can use them to mobilize without any stem cell transplantation. If we give them certain drugs and certain, I would say, chemicals to mobilize and to force them to travel where the spinal cord injury is. This is now one example how we are already using the stem cell therapy. This is a transplantation of corneal stem cells, and this is a human patient. You see the morphology of eye. He was blind on my eye for ages. I think he was blind for 16 years. And the scientists developed the technique that they can take stem cells from his healthy eye, put these stem cells on certain matrix. Matrix is scaffold. And this is matrix. You see this white, what the surgeon is doing now, covering the eye. And on the surface of this scaffold are stem cells from the own patient. And when you put these stem cells in patient eye, after a certain time, this matrix will be resorbed, so disappear, and you have only stem cells. And after 16 years, these guys are again able to see. That's one example, using the stem cells. But before this was, I think, 2 decades how to develop this strategy, this technique, using animal disease models. The same for this example here. There was a young mother, and she had, here you see with the arrow, the windpipe narrowing. You see on this image on your left-hand side. So this was collaboration between England and Spain. The scientists took trachea from the dead body and removed all cells from trachea. Then you have again scaffold. And then they took stem cells from this mother and put stem cells on this trachea, and they created a new windpipe, a new trachea, and transplanted back to this mother. And she's living now just normal life with this. So you see, that's a combination. We call this tissue engineering and stem cell biology. And I think these are very, very nice, promising results. But again, as a nice warning is this scientific publication published in 2009 in PLOS Medicine. There was one guy, a child, who suffered from disease, and the parents find somewhere via internet probably that there is a successful treatment in Eastern Europe to treat this disease by stem cells. So this child went to stem cell transplantation, and after a couple of years started to complain about certain problems, headache, etc. And when the doctors or physicians in Israel done magnetic resonance analysis, you see here where the arrows are, here in brain and here in the spinal cord, tumors. So that means these kids or these stem cells introduced somewhere in Eastern Europe developed after a couple of years in tumors. And after analysis of these tumors, they found out that these are fetal stem cells. That means from aborted fetus. And what is the most worrying in this case is that they found the cells which have male and female gender. So that means the scientists, physicians or whatever, minced different fetuses, female and male, prepare one cocktail and introduce the body of this child. And you see the result is development of tumors. So I think this is one of the, I would say, best way to discuss where we are, what we can do with stem cells, why we need embryos, why we need stem cells, but also the best way to tell people you can't use them for all diseases, or even worse, you can use them, but you can create more problems than you help people. And I'm coming back to this one slide. What you need to develop and to move stem cell therapy is the time. The same for one chemical drug. The pharmaceutical companies invest $1.5 billion for one chemical to become drug, to become medicine. And it takes between 10 and 15 years from the lab till patient. So you can't take stem cells and introduce them immediately to human body without knowing what happens to them, because you have seen what may happen to them. And this was my last slide, and again, after all this lecture, I'm using again the opportunity to thank the people which I worked for the last 19 years, whether this was Germany, United Kingdom or Spain. This is our small, nice hospital and in south of Serbia, in Leskovac. And we are doing now, in addition to science in Kragovac and stem cell biology, we are doing, I think, a very nice job. These are not cloned kids, these are IVF kids. And meanwhile, there are more than 300. And I think this is a nice, very nice job, because all these patients, for certain reason, can't have kids, whether this is a obstructed tuba or there's not enough sperm or whatever. The problem is we're doing our best to help them and to become mother and father. And again, thank you for the invitation. Some of you, I heard, are already molecular biologists. Probably some of you, plenty of you are dealing with bioethics. I apologize if I use some specific scientific terms, but again, for me it's very difficult to speak the same language, because this is the language we're using on a daily basis, so sometimes it's coming automatically. But I thank you very much for your attention. Thanks a lot.
Thank you very much for